peptic ulcers. We will discuss causes, diagnosis of the peptic ulcer, and also differential diagnosis, complications of peptic ulcer, treatment of peptic ulcer. So we will start by symptoms of peptic ulcer. Sometimes the patient suffer from heartburn, sometimes upper abdominal pain, nausea, bleaching, vomiting, blood in stool, weight loss, weight gain, bloating, loss of appetite, yellowing of the skin, sometimes whites of the eyes, sometimes difficulty in swallowing. So sometimes also the patient suffer from complications of peptic ulcer disease, like bleeding, perforation, ulcer perforation, blockage of the stomach,